मेथड ऑफ असेसमेंट उसमें मेनली हम फोकस करते हैं फोर्थ पे। वो फर्स्ट वन है इसमें से इंस्पेक्शन, पाल्पेशन, परकशन, फोर्थ अस्कल्टेशन। एक्स्ट्रा इसमें दिया गया है ऑल्फैक्शन। सो फर्स्ट वन inspection. It is the use of vision and hearing to distinguish normal from abnormal finding. Inspection is a simple technique and the quality of an inspection depends upon your willingness to be thorough and systematic. Principle: adequate lighting, position, expose body part, inspect each area. When possible, compare each area with opposite side of the body. Use additional light to inspect cavity. Do not hurry. Pay attention to detail. General inspection of client focused on overall appearance of the health or illness, sign of disease, facial expression and mood, body size, grooming and personal hygiene, color, texture, symmetry and movement. Second one है palpation, which is the act of touching a person in a therapeutic manner to elicit specific information. Palpation involves use of hand to touch body part for data collection. The nurse uses fingertips and palm to determine the size, shape, and configuration of underlying body structure and pulsation of body blood vessels. It helps to detect the outline of organ such as thyroid, spleen, or liver, mobility of mass. It detects body temperature, moisture, turgor, texture, tenderness and thickness and distension. Principle of palpation: perform slowly, gently and deliberately. क्या करना है? Palpate करना है. Encourage the patient to continue to breathe normally throughout palpation. If patient is experienced during the palpation, if pain is experienced during the palpation, discontinue the palpation immediately. Inform the patient where, when, and how the touch will occur, especially when the patient cannot see what you are doing. Position to be taken to avoid injury a patient. Do not try deep palpation without clinical supervision. Do not palpate without considering the patient's condition. Do not palpate a vital artery with pressures that obstruct blood flow. Percussion: it is the technique in which one or both hands are used to strike the body surface to produce a sound called percussion, not that travel through body tissue. The character of sound determines the location, size, and density of underlying structure to verify abnormalities. An abnormal sound suggests a mass or substance like air, fluid in an organ or cavity. Type of percussion: direct percussion, indirect percussion, and fist percussion. Direct percussion: it is by tapping the affected area directly using flexed finger. Indirect percussion, mediate percussion. It can be performed by using two fingers. Left middle finger, pleximeter finger, is placed over the area and its middle phalanx is tapped with the tip of rigid middle finger or index finger, percussion finger or flexor. Fist percussion: it involves placing one hand flat against the body surface and strike the back of the hand with a clenched fist of the other hand. Direct percussion is used to assess the sinus or infant thorax. Indirect percussion is used to evaluate abdomen or thorax. Another method of indirect percussion is tapping with the rubber head of the reflex hammer. First, fist percussion to evaluate back and kidney for the tenderness or pleasure. Fourth, last one, auscultation. Auscultation in this four characteristics of sounds: frequency, loudness, quality, duration. So frequency or number of oscillation generated per second by vibration object. The higher the frequency, the higher the pitch of sound and vice versa. Amplitude of sound wave. Loudness, amplitude of sound wave. Quality, sound of similar frequency and loudness from different source, duration, length of time that sound vibration lasts. What you should know: need good hearing acuity, good stethoscope, and knowledge of how to use it. Place stethoscope on patient's skin directly, free from extraneous sound. Require concentrate and practice. Normal body sounds. Normal breath sounds are classified: tracheal, bronchial, bronchiovesicular, and vesicular sound.